3, 2, 1. Today we're going to continue our conversation on quality issues. And just for a rehash, we have talked in the past about high reliability organizations. In fact, it's on our strategic plan to become an organization that would meet that definition. And what we've talked about to some degree has been what those components look like. In definition, a high reliability organization is one that operates in a very hazardous environment, but in the face of that, they do a great job of not making mistakes, avoiding adverse events, and they do that consistently, durably over a long period of time. One of the things we've mentioned was that high reliability organizations are focused on failure, identifying the potentials for failure, recognizing when they happen, fixing them, and moving on and learning going forward. We've talked about using frontline staff to be autonomous to a degree to help identify potential problems and fixing them ahead of time. We've talked about how the organization decision-making needs to be made. But one of the things I'd like to just bring up today is some examples of what it means to really change things such that you are a high reliability organization focused on the potential of avoiding failure. There's a term that's used frequently when they're talking about adverse events and avoiding problems, and it's Swiss cheese. Everybody knows what that means, Swiss cheese. Well, it's based on a guy named James Reasons, and he came up with a model of avoiding adverse events. And here's what it kind of looks like. That is a potential problem. A patient starts here in the presence of a potential problem. Again, we're doing potentially hazardous things, chemotherapy, surgery, all those kind of things. And the patient needs to end up over here without having a potential problem. So what do we do as an organization? What we really try to do is along that path, we erect barriers to prevent harm happening to that patient. What does this have to be? What does this have to be to prevent this potential problem from affecting the patient and ending up being a harm? It has to be perfect. It has to be absolutely foolproof so that somewhere when this potential harm comes along, it is blocked. The problem is, in this process, we recognize that there is no such thing as perfection. And the reason is because the people, the places, the structures that we use here are imperfect. They're fallible. So what we have instead is something like this. Remember what I said? Swiss cheese. So what we have instead is something that looks like this. So here you have your potential problem, and it goes and oops, it makes its way through that first barrier, that first obstacle to prevent that patient from being harmed. So we need to recognize that maybe we need to have another barrier in place. And if it all works appropriately, it'll bounce off that one, the patient will walk through the path and not end up in any harm. The problem is, there's still a potential, this Swiss cheese effect. So the idea is to erect as many of these processes that stop that. And the hope would be that somewhere along the way, on this Swiss cheese, the holes, the imperfections in these processes that we set up will actually stop that harm from happening. And what this is really based on is the recognition, again, that we are not perfect, that the systems aren't perfect. I'll give you a good example of what we're talking about. Pretty much a true story or variation on a true story. You have patient A and you have patient B. Both of those patients are going to have exactly the same surgery. This patient is going to have it by Dr. X. This patient is going to have it by Dr. Y. The patient is checked out in the holding area. They've confirmed the patient's name and they move it on down. But unfortunately for this patient, they thought patient A was who they were working on, but actually it turned out that it was patient B. So this patient A, or B, actually ends up going through the system, different doctor patient, and got all the way to the operating room before it was recognized that it wasn't that doctor. We thought it was patient A, but it was actually patient B. So what happened was these systems failed early on, but ultimately it was caught. So the whole idea behind this Swiss cheese effect is to recognize that we have the potential, A, to do harm, but we have the obligation to create obstacles to make that happen. So in our situation here, the appropriate time out was missed beginning on through the process. The second step it was missed, but somewhere in that process, before the patient was asleep, before any harm was done, the system caught it. And that's the effect of creating good systems to avoid patient harm. And that's called the James Reason Swiss cheese effect. It's a little bit more complex than that, but that's it. So, in your world, what are the processes that you set up? What are the potentials for the process that you think is going to work out just fine for actually failing? Be thinking about that as you go through your day. And that's all I've got to say about that.